And scalp, it would typically do luxurious, Kathy used to say delicious things, right? We want them to relax and feel good and just drop down to that parasympathetic nervous system. And, really, that's perfect. That's great. This is really no different. However, people hold a lot of stress and tension in their job. How many of you have TMJ issues? Yes. Oh, do you? Okay. So I'm going to show you some stuff from masseter specifically that can help with TMJ issues, the tension of TMJ, and also, of course, help relieve some of the stress that we keep in our girls just from life. But with that, we also have to talk about temporalis because temporalis is a synergist. And believe it or not, we can get trigger points in temporalis too. Having temporalis work firmly actually feels kind of amazing. People do have a fascial band that goes from frontalis all the way back to occipitalis. Do you remember what that's called? Galea aponeurotica. And anywhere where there is fascia and skin attached to that fascia, like in the top of the skull, it can get stuck. Lesions can form. Do a little bit of assessment for that as well. Okay. This is not a real long demo. If you're starting out, you want to do something really awesome. Skin of your forearm super soft. And do them. Just don't do this to the freshly shaved or not quite shaved. You will tear up your forearms. Yes. So everything that we do on the face too always should go towards the head. That's more of an esthetician thing. You don't want to cause wrinkles by pushing down. I mean, you're not going to, but if you just keep it in your mind to move everything towards the crown, it's better. All right, so we're going to focus in on the masseter. Now, remember that you have the parotid glands that sit on top of the masseter. So when you're massaging back here in your Swedish routine, you're actually massaging the parotid glands because those are superficial. Now you focus your attention into the masseter, and that's fine, but we can't do deep work from this angle because we're going to smash a gland. Let's not. Okay. So we can work right at the attachment, right? The zygomatic. We can get some of the muscle there. Then I'm just going to do some small circular friction. I'm keeping my thumbs out of the way. Just make sure you're aware of your thumbs when you're doing face work because they end up in places if you're not aware of where they're going. Sometimes in ears, I don't know, you find little holes they like to sit in. Okay. So even though I'm doing circular friction, the force of my stroke is towards the head. Okay. So if I really want to get on masseter, my client is having jaw pain, TMJ issues, then I need to come at it from an anterior perspective. Okay. So I'm in contact with her teeth here. So we have, face, skin, lips, cheeks, teeth. If I push towards the table from this position, then I'm on the anterior border of masseter. Okay. And that is where we will get our deeper masseter work. Now I'm just using my fingers on the anterior edge of masseter, but if I was going to do trigger point work, I'm going to sink a thumb in one side at a time. Do not do both sides at a time. Okay, that's gonna hurt. They're not gonna like it. I would sink my thumb in and push straight towards the table for a trigger point. If they have trigger point, it might cause tooth pain, like referring into the teeth, up into the eye. Like masseter can go a bunch of different places, and the trigger point charts are over there. All right, show you. But you can use this as a treatment stroke as well. And you can do a pin and stretch. And this actually feels really nice and is less work for you and less painful for your client, like if they do have a trigger point. So pin the tissue down and then ask your client to gently open their mouth. Perfect. Going. Excellent. And release. Yep. Yes. You do want to do both sides at the same time if they're going to open their mouth. And pin the tissue down and open. Nice. Nice. Oh, that's softened nicely. Just even a couple of those can be really effective. But again, if you're going to do treatment strokes, it's got to be on the anterior, not back here. Okay. You don't want to be pushing on those glands. All right. So we can, like I said, work the attachments with some cross fiber friction. Is that okay? And she's gone. When you get monosyllabic, you're good. That's good. Okay. Slide up into temporalis. Remember temporalis and that temporal fossa there. And you notice that I'm moving the scalp. I'm not washing the hair. Force of my force of my fingertips is into the tissue. Up in here is where we'll be on the belly of the muscle. And if they do have jaw issues, TMJ, etc., these will be tight as well. Right in there. Is that tender? Mm-hmm. You know, so I can feel a little adhesion on this temporalis, this side. So I'm just going to do circular friction, but nice and slow. And notice I'm not turning her head to either side because I'm not getting around the back of the skull. We're focusing on temporalis. And I can do one side and then the other, or I can do both at the same time. But if I'm really focusing in, I want to do one side. That refer anywhere?
No, it just feels tight.
Yeah, she has a little bit of a temporalis adhesion right in there.
That's probably my son.
Right. It has a name. And his name is Child. That's fair.
It refers to him.
Nice and slow, and you'll feel those. Now, remember, you are pushing in more. I'm at a level 3-4 in here. Okay. And it's my fingertips, nothing else. And it's just my body weight. As I slide up into the scalp, again, I'm moving the scalp. I'm not doing this kind of thing. It's a totally different movement. So I'm taking my thumbs at the crown and I'm moving the scalp in small circles. And I'm feeling for any areas that feel stuck or any directions that feel stuck. Actually feels pretty good. And you can see it moving up here. And also pressure at the crown feels pretty nice. So I'm still at about a 3-4. Actually more 3 than 4. And incidentally, right along this line here, from the corner of the eye all the way back along the sagittal suture here, our sinus points. So by doing this kind of thing near the crown, they're also hitting those. So if your client is congested, this might help good. Or if you just turned your client over and they're all stuffy. You can loosen the fascia around the ears. One. By just moving everything around. Like the goal isn't to press and hold or anything like that. The goal is just to move all the skin over the skull. From here, of course, you could go right into your neck work. You could do suboccipital work. Since you're right here, you could just transition right into some circular friction along the suboccipitals. But either way, it's always nice to finish with what one of my clients used to refer to as her smokestack. She used to tell me when I would come up through here like this, she's like, it's like you're pulling all the smoke out of my head. Just all my worries coming out of my smokestack. Now she was 90. So smokestack meant something to her. If you don't know what that means, watch some old cartoons. I went through taking all their worries. Okay. Question. Okay. Go do it.